All right, so today we're going to look at the AP-SI joints, the RPO and the LPO-SI joint as well. Starting off with the AP-SI joint, we're going to be in a very similar position as we were in the sacrum view. We want the patient to lay supine, have their arms up and out of the way of the anatomy. And once again, we're looking for a central ray entrance point of approximately 1.5 to 2 inches above the pubic symphysis, which is going to be very close to midpoint in between the as-is, which is easily palpatable, and the pubic symphysis. Notice our light field once again reflects very similar to that as the AP sacrum, where we have the top of the light field at the iliac crest and the bottom of the light field is there at the pubic symphysis. We're also able to collimate a little bit from side to side. With our central ray entrance point entering 1.5 inch to 2 inches above the pubic symphysis, we will want to ensure that we have a 30 to 35 degree cephalic angulation for our central ray. So that's 30 to 35 degrees cephalic angulation. What we will be looking at here is specifically the sacroiliac articulations, which are visualized right here and right here. So one of the things you may also notice, previously we talked about the sacral foramina. They are much better visualized on this particular patient with this higher degree of angulation, and you can kind of see these. I'll just highlight the one side, but definitely much more open in this particular view. And so when we are in RPO position as a patient, it is our left SI joint that is visualized. For this, we want to rotate our patient up on a wedge, and we want that degree of angulation to be approximately 20 to 30 degrees. And we can utilize this foam wedge that's here, trying to get that 20 to 30 degree angulation of the sacroiliac joints. For our central ray, we just need to be approximately 1 inch medial to the as-is. Now our SI joints aren't very big, and as you can see in this particular image, they possibly were centered just a little bit high, but nonetheless you can see the left SI joint is open very well. Obviously the central ray was a little bit high. We would like to have it be more here, which is 1 inch medial to the as-is. It's an identical procedure as you roll the patient into an LPO position. We are now looking at the right SI joint, and in the image to your right you can see it's well demonstrated here in this region here. There's your SI joint, nicely opened right there. Once again, a 20 to 30 degree angulation. So there you have it. That is your routine SI joints. Know that these can be done in RAO and also in LAO. If that is the case, we will be looking at the other joint space.